Welcome to Slut in Training, hosted by Missy Greenberg.
Jordan Carlson.
Tanya Ross.
Welcome to Slut in Training, girls.
Thank you.
All right, well, let's kick off the show. I have the word of the episode.
Mm-hmm.
And the word of the episode is inspired by our next guest. The everything shower.
Oh, God.
The everything shower.
Is it like
It
you're
sounds
being...
messier than it is.
Okay.
Oh, okay. So
Is
you're
it-
not being covered in everything.
No.
Is it where they don't shower for days and then have like dirty sex
Literal
and then-
dirty sex?
Yeah, and then shower or
Oh.
something?
No.
Okay, 'cause I saw a
No.
lot of things for that.
Yeah, I know. It is a big name.
Are you in the shower when it's happening?
You are in the shower.
Okay.
Yeah.
So
It is not a golden shower. I don't know if we've
No.
touched on golden shower. I was
I think
debating.
we have before, yes.
Oh, we have.
Yeah.
Okay. All right. So this is the everything shower.
So you're in the shower and you're being covered with everything but golden things.
Okay. Okay. When after the man ejaculates, covers the other person all over.
No.
Are they just covering each other in fluids?
It's not as dirty as you think. So it's when someone exfoliates, shaves, deep conditions, shower oils to prepare for a hookup. But you only do it if you really like someone.
Are
Oh,
they deep
God.
conditioning their like
You can
their
deep condition.
flower?
You can deep
See?
well, you've got hair down there. You can deep
That
condition
was
anything.
Not dirty.
It's not dirty. It's very clean.
Shame.
Boo.
Shame.
That is not
Boo.
Shame.
On that note, let's bring on our guest who actually
Yes.
taught me this
Wonderful,
Word.
wonderful word.
phrase.
So,
Sorry.
yes, our next guest is coming on anonymous, so we'll be referring to her as Gabby, because she literally knows the ins and outs of women's flowers. That's why she's anonymous. Better to be. So welcome, Gabby.
Welcome, Gabby.
Gabby.
Yeah.
Thank you for having me.
Thanks for coming
Yeah.
on.
I'm excited.
Yeah, we're excited to. Oh, yes.
Talk about flowers. Lots of flowers.
We're talking about flowers. Yeah. Gabby, on our show, we'd like to ask our slut guests to tell us what slut means to them.
To me, it's like more of a positive, upbringing. Because, when you're embracing yourself, you're loving what you're doing. I think it's something to embrace more than to shame yourself. I believe that, being that word, being a slut, you got to wear it with your chest, especially nowadays. Like, there's no shame in that.
Wear it on your chest, literally. We do that often.
Yes.
Welcome,
do.
Gabby.
Yeah.
I'm so excited to have you. One, I am a huge fan, as Gabby knows, of skincare. I think it might be the Korean blood in me that's just built in genetically that I'm obsessed with skin. I think skin and self-confidence and sex all are related. If you don't have great skin, you're not confident in your body, you're not confident in the bedroom. Gabby, I know you're anonymous, but can you just tell us about your background?
So I started off in like the operating room. I'm actually an aesthetic nurse. So it's kind of like, I started off as a nurse working in the hospital, working with, I call this small dick energy surgeon.
I love, back up, small
Surrounded
dick
by the
energy.
and I was like,
Yes.
oh my gosh, like it really did justice for me, just like knowing, what direction I want to go into with my career as a nurse.
Mhm.
It opened a lot of different avenues for me. I got introduced through, this beauty of medicine, through plastic surgery, seeing all the different procedures people do, the type of things I see in the OR just really sparked my interest in being an aesthetic nurse. And then that's where I kind of got my cue in through this specific plastic surgeon that was like, hey, look, who wants to get trained in Botox and filler? I'm like, hell yeah, me.
I know.
I'm not
Sign
going to
me
say
up.
no to
Yeah,
that.
yeah. So you're currently at a med spa as well.
Yes.
correct? So you've seen kind of the array of procedures done from superficial to not so superficial.
Oh,
under the knife.
I was going to say like actual operation kind of
Yeah,
things.
Yeah,
Yeah.
so many,
Ooh.
revision rhinoplasties,
Oh.
all these crazy, facelift deplaning where like your whole face skin is literally off your face, and they put it back together. It's the most coolest thing ever.
Oh my
did you
god.
freak out
Yeah.
And
when?
a lot of BBLs, all those amazing things that can really transform
Wait,
someone's confidence.
what was
I
the
like
last letter that you said? BBL?
BBL.
DBL?
BBL.
What is that?
What's that?
Big
Big dick. BDL? Big dick little?
Brazilian butt lift.
BBL.
How do I not know this?
Oh, Brazilian
Now we
butt
do.
lifts.
Now we
Yeah,
do. Wow.
yeah.
Okay.
That's got to be
BBL.
crazy
Oh
to
my
see.
God.
I've heard that's actually a really kind of tough surgery to
Yeah.
recover from, but also kind of you risk your life doing it.
Really?
Yeah.
Oh shit.
Yes.
I,
So many people glamorize like getting BBLs and revision rhinoplasties, but it's so crazy to think like this is a like really intense procedure, and people just on TikTok like come with me to get my BBL, and then like they just wake up and they're like I got my BBL.
yeah. That's probably cool when you're not on the operating bed knocked out.
What about
But
scars?
I've heard there could be huge
Yeah.
complications with the butt lift surgery.
Is it a big scar?
Yeah,
with
where are the
butt lift?
scars when they hide
Under your
do
cheek.
that?
So usually some surgeons could do it with a cannula, which means like this long needle.
Ooh.
So like
Okay.
incision marks are super small, which is amazing, and how
Mhm.
far surgery has gone, because everybody deserves to be able to do what they want with their body and still flaunt it without
Yeah.
having those
Yeah.
battle scars.
100%.
Such a beauty, that's the beauty of the future surgery, future beauty, future plastic surgery is it's so minimally invasive. Some they make a big incision, but a lot of people could recover really well. They usually utilize a lot of silicone gel, which helps bring down the
Oh.
scars.
Oh.
Interesting.
So silicone gel is your best friend if you guys ever get into a situation for
The butt
scarring.
lift?
Oh, okay. That's
Yeah.
good to know actually.
Well, Asian scar is worst.
really?
Really?
Yeah, ethnic people's scar is worse. That means
Yes.
me, not you guys.
Just in case
I
you
don't know
were
what that
wondering.
In
means.
case there was some confusion
Oh my
on the
God.
podcast because it is audio.
Thank you, Missy.
You're
Thank
welcome.
you.
Yes. So we do.
Thank you. Thank you
Is that
for-
correct, Gabby? I'll ask the nurse.
Oh, so true. I
Really?
get like, what is that? A keloid. Have you guys ever heard of
Yes.
Oh,
keloid?
yeah.
Yes.
Asians
like
and
raised,
keloids
right?
Yeah.
are
Raised
like
scars.
best friends. Yeah. Or enemies. Frenemies.
Your frenemies
Yeah.
are keloid
Mhm.
scars.
Yeah.
Oh boy.
It's hard being
You have
Asian.
weird friends.
It's
Missy.
hard being fucking Asian, people.
We need
For
to go
sure.
in a way where we should normalize how we feel on the outside. Like it's so valid how to feel on the outside. People shame so many women, so many men on how they feel on the outside,
Yeah.
Mhm.
I have no shame in any of that. Um,
You shouldn't.
You did touch on something that we will come back to, Gabby. But just for clarity's sake, for a med spa, what do people go to a med spa for? Like besides Botox and filler?
So they go for like microneedling,
Mm.
laser hair removal, a lot of facials, chemical peels. In the aesthetic medicine, we've introduced so many different things, such as like sexual health,
Mm-hmm.
like wellness with IVs and vitamin shots to help with their, inner beauty as well.
Mm-hmm.
Feeling good on the outside will make you feel good on the outside. And then also different things like microneedling, those kind of things. But
Yeah.
one of the things I really like in the field I'm in, they're looking into regenerative medicine,
Oh.
where you're using like your own blood
Mm-hmm.
to help rejuvenate the skin.
What?
Um, you could use that in multiple ways, not just rejuvenate the skin. You could also
Can you
stimulate your own libido with
I
your
was gonna say, can you
PRP.
rejuvenate other parts of your body? We
I
could
had a
all use
feeling
that.
would be coming.
Yeah.
Oh, Missy.
Well, it is a
Oh,
sex
Missy.
podcast.
Yeah.
I mean, we'll
So-
touch on that later.
Yeah.
All right.
Okay. I'm just.
Okay. Can we just talk about skincare 101? because I'm really into skincare.
Yeah.
Yeah.
And for confidence, because we're talking about confidence, what skincare regimens do you suggest for adult acne or wrinkles or my favorite, brightness and glowing? What do you recommend or suggest?
What's your go-to?
Yeah, that's a great
For
question. I'm glad.
me, less is always more.
Mm-hmm.
Less is
Okay.
always more.
Mm.
You see these intent, like, the internet has really made it seem like doing skincare is the most impossible thing, especially with,
Yeah.
everyday basis. We're busy. We don't have time. We're tired at the end of the day. I think keeping it simple, keeping it minimal is
Mm-hmm.
the best recipe for yourself. You
Wow.
don't
Yeah.
need the most expensive thing. You don't need the most high-end thing to feel like it's going to work. That's all just, like, I mean,
Bullshit.
medical skincare is really it. But, if you want to really set a foundation for yourself,
Yeah.
always use gentle cleanser that's, perfect for your skin type, whether it's you have dryness, combination, oily skin. It has to match with your skin type.
Mm-hmm.
And no one knows your skin more than yourself.
What are current skincare trends? Like, is that
What's the most popular
Yeah.
thing happening right now?
The weirdest thing that I've ever heard with care trends right now is beef tallow. I don't
what?
know if you guys heard that. It's like
No, what's beef tallow?
they use beef fat and transform it into a moisturizer, and then they put it in their skin. And one of my colleagues actually made homemade beef tallow, and she gave
Ooh.
me some.
Does it
It straight up smells
smell?
fake, so I'm just like, I'm not putting this on my face. It smells
I
like
Yeah.
know.
That sounds
hay. So I
Mm.
I was like, a big pass. I don't think it's that really effective, but I mean, it's blowing up on TikTok. Everybody and their mom,
Yes.
beef tallow this, beef tallow that, and I'm just like, I don't know where this is coming from. I'm just so confused. I'm like, oh my
what
gosh,
I saw that too. I saw
what
a
is
lot of
it supposed to
posts.
do? What is the benefit of it?
Yeah.
Do you rub it
just
head
the
to toe
moisturizing
in between the
aspect and
head
helping the
to toe?
dryness.
Oh,
Oh.
Ew.
I always thought that you would put it in food, like in soup.
that's bone marrow.
Oh shit.
Oh.
Just
Well, you never
stick
know.
with
Okay, wait.
I
What
like the
about isn't there
plant-based.
like it's like snail something that was popular for a while. It's like some sort of
Yes.
yeah,
Oh
what
yeah.
is that?
Snail mucin, so it's just
Yes.
used like I would say like a toner to the face
Oh.
and
Mm.
hydrating.
Mm-hmm.
But right now what's really popular is salmon polynucleotide DNA,
Mm-hmm.
which is salmon sperm.
Yes.
What?
Yes. You want sperm
Everybody
on your face.
is raving about it. The
Mm-hmm.
current Med Spa I work at, we do implement it, and
Oh,
I
you
see
do?
amazing results.
I'm gonna make
Um,
an appointment next week.
the whole glass skin
Yeah.
trend really is this is the backbone of it.
Did it
Yeah.
Really?
The
start?
salmon
I
sperm
have the
DNA.
masks.
Did
The
it? Did it start
salmon.
in Korea? It
Yes,
probably
yes.
did.
Oh
Yeah.
yeah.
Oh
All the
yeah.
good
Fucking
stuff.
All the
Koreans put
did the
anything on their face
They
to
have
make it
beef
work.
the beef one also start in Korea? Have they all is that where they all have
Koreans
originated
will do
from?
whatever they need to do
Beef,
to look
salmon,
classy.
snails.
Yeah. Gabby, what's one myth or mistake that you find in your clients that kind of are repeated over and over that they shouldn't be doing?
Good question.
So I feel like a lot of people think, Botox could make their face like it could shift shape, change their face into
Mm.
like this snatched jaw look.
Mm.
And like
Snatch jaw.
What's
What is
that?
that?
Tell us snatch
I
jaw.
know.
Yeah,
Gabby
what is
has
that?
these terms
Like
that I'm
something
not
else.
like
Ooh.
redefining
I'm
for me.
impressed.
Yeah.
like with masseters, it just helps like, slim out your
Oh yeah,
masseters
you want
is like
soft
where you can find
masseters.
your jaw, like
Mm-hmm.
a muscle.
Mm-hmm.
People get in like Botox, Xeomin, Disport into your masseters to, help bring down that muscle. And
Yeah.
people just think like, oh my gosh, it's gonna snatch me, which means like give me that defined jaw.
Mhm.
But all it does is just slim the face.
Oh.
Another myth that people come in
Oh.
is that like I would say, not like, if you don't drink water, like you're gonna like age faster. And like they drink water, but in the weekends they drink alcohol all day, all night long.
Mm-hmm.
Um, I mean, water does do wonders for your skin,
Mm-hmm.
but you could get
You still
different
have to be
avenues
active.
of
Yeah.
hydration.
Yeah.
Still need that
Yeah.
sperm.
Yeah.
Yeah.
I love sperm.
Oh my God.
Salmon.
I love salmon.
Mhm.
Salmon's
It's delicious.
delicious. So
Oh,
many
God.
ways.
Sashimi.
Where have we
All right,
gone?
Gabby, let's be honest here. What do women do? Let's talk about sexual health that you've seen, I think, more in probably the doctor hospital setting than med spa, but you can correct me. What do women do to improve their sex life? Like, what are the most popular requests? What's happening right now down there?
So
Currently.
a lot of
Quick
people, I
change.
don't know, this is very viral too because of the show Mormon, The Secret Life of Mormon Wives. I don't know if you guys are watching that,
Not
Mm-mm.
watching it,
but
no.
one of them, you could definitely refer back to
Okay.
that specific episode. Um, Vaginoplasty. So it's basically a surgical procedure
Yeah.
to help like tighten, reconstruct, or
Mm-hmm.
Oh.
basically make your vagina the way you want it to look.
Mm-hmm.
Oh.
It's performed for both medically and aesthetically.
Mm-hmm.
A lot of women, they experience like post childbirth like laxity down there.
Yeah.
Um, that's something that is very, very, very common, more common than you think. Or,
Hmm.
different ways to help improve the look of it. It helps with, improving sexual function. And it also
Oh.
addresses like pelvic floor weakness and all these
Oh, yeah,
amazing
yeah.
things. Not as just aesthetically, but medically too.
Yeah.
But, majority like that, we see with this is there's great benefits
Yeah.
with getting this.
Well, I get the helping functionally, but let's talk about the aesthetics. What are we talking for aesthetics? Like, should we all be grabbing a mirror and going to the bathroom and looking at the aesthetics?
It depends on person to person.
Mm-hmm.
Um, in regards to this, unfortunately, I don't see them pre-operatively or post-operatively. I just see them
Oh, well then,
operatively.
okay.
The whole procedure is just, like reconstructing it. Like it's basically a facelift for your vagina.
Oh,
Interesting.
oh.
So
Okay.
yes.
not
So
Missy.
Tanya, just so you know,
I don't need
She
one.
really-
she's
she
good.
I'm good.
She's confident.
But to
She's
each his
confident.
own. I mean,
No, for
like
sure.
no judgment.
No, I
It's
mean those
amazing
babies
that
rip
they can
you
do
up. They
I
ruin your
had
body.
C-sections, so I'm
Oh,
good down
so
there.
did I.
Ooh.
Hmm
Yeah, yeah. We have
Yeah.
other issues, but yeah.
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 Different ones.
Yeah. No, for
Yeah.
sure. We're all about improving sexual health.
Oh yeah.
Yeah, and I heard some, women get to choose how they want it to look.
Oh.
Um, so you
Oh,
have
what are
it's
your
basically
options?
so you could, reshape your labia, you could tighten certain areas.
Wow. It's like
There's different avenues they get to choose. And,
Oh.
I don't know how well, post-operatively they're happy with it,
Mm-hmm.
but based off of what I saw on The
Yeah.
Secret Lives of Mormon Wives, they're really happy with it. It's like their reaction is insane. It is a life
Really? It's life changing.
experience.
Yeah.
I'm so
That's
curious.
great.
Do you go in and they give you like a chart? Like which of these options
Yeah,
would you
kind of like when
prefer?
you want a
Pictures?
boob size,
Yeah.
you're like,
Mhm.
which
So
boob size do
they
you
give
want?
pictures.
Yeah,
'cause
that's
otherwise
I'm
I wouldn't
sure.
have any clue what
Yeah,
you're
like
looking
how else
for.
would you know? Exactly.
Oh,
Yeah.
I guess.
Yeah.
That's
Yeah.
true.
Yeah.
Curious.
Okay, since we're talking about the vagine.
Yeah.
Okay, this is like serious now.
Seriously, Daisy.
Okay.
When you say vagine.
Thank you.
Vagine.
Now, I'm not even going to talk about shaving because I feel like that should be an emergency case situation. But I love waxing because I feel like it's my meditation and serenity time. But I have friends who feel like when they get waxed, they just lost a fight with the weed whacker. So
You're talking about your pubic hair, not your armpit
I
hair.
don't have that. I'm good.
Oh.
But I'm talking about my friends.
Oh my God! Stop!
Friends.
Stop pointing at me.
Friends.
She's pointing at me. Stop it.
I'm lasered. I'm in camp laser, so I don't know what you're talking
So-
about. More importantly than waxing or lasering, I want to make sure we cover this because I had a friend who told me that she has friends who fly from New York to Miami for this special procedure, almost like entertainment for them. at med spas, and I think Gabby, you and I have talked about it. They have the special letters O shots and P shots. Will you
Oh,
please elaborate? Because let's enlighten my co-hosts here.
yeah, please.
So P shots is basically penis filler. It helps like enhance the girth of your penis. It doesn't elongate, unfortunately. It just helps with girth enhancement.
Like,
It
how much
involves
filler can you? How
Does it?
Doesn't it
how
hurt?
wide can you make it without it
What is it?
looking like it's gonna explode?
Yeah, like what is it in the filler? I'm trying to understand because that
And
where you're
wouldn't it
putting it.
numb it or?
We're trying to visualize it,
Yeah,
Gavin.
I'm
So
just like
yeah,
yeah.
so it's filler is hyaluronic acid. So
Mhm.
basically,
Oh,
you make that in your body. It's just basically helping with plumping it.
Oh, okay.
And
Um,
how do you get it in the penis?
Like a big.
so the process of it definitely really clean that area, because especially that area is, you don't know what it's been through, so you gotta clean
oof.
that.
No one
You
knows
don't know
what it's
where it's
been through. He probably doesn't know where it's been. Okay.
And then you numb it for sure.
Ouch.
And
Oof.
you numb it with lidocaine topical for about 1 hour, honestly.
Oh,
Yeah.
And once that
painful.
gets fully numb, then we start the procedure. We usually do it with a cannula.
Oh.
Cannula is basically like a needle that's not pointy at the end.
Mm-hmm.
Oh
Um,
God.
Mm-hmm.
and then in order for that in order for that cannula to go inside the shaft, you have to make a little porthole with a sharper needle. So you make that porthole, and then you just go through and glide through until you get to the area that they want it filled.
Oh,
um,
They get to
and then you
pick the
fill the
area?
area. Yeah.
Oh.
It's really crazy, because this is all done under just topical lidocaine.
Yeah, you're not
It
passed
takes
out.
about
Yeah, I was about to say they only put like
I would be like,
topical. That's
please,
crazy.
yeah, I'd be like, please knock me out,
Yeah,
and then
or
inject
like
my penis.
inject something. Like, yeah,
Yeah.
I don't want to feel
Yeah,
any
it's
of
like
that.
Novocaine.
Yeah,
Oh my
no.
And
God.
usually it takes like 30 to 60 minutes depending on the
Oh
pain
my
tolerance.
God.
And if you guys can visualize this, as
oof.
you guys may know,
I'm
it is
trying.
super vascularized down there, so it's low key a bloody
Ooh.
Do
procedure.
they have to strap them to
Our
the table?
operator's shaking his head right now. He said, sign me up.
No, I do. Like, how do they just not jump up and run away? Like that's just. It sounds like so much
How-
pain.
Yeah. And how
Yeah.
often do these clients come back? Like,
Yeah.
are they doing it quarterly like Botox or, I mean,
Oh.
It depends of
That
how
sounds
much they
like
metabolize
pain.
that filler,
Oh. Okay.
honestly. And you barely, I mean, it might be like less than a year, depending how much you use
Ugh.
your bestie.
Yeah, that's true.
Okay.
You overwork that guy and he's got to refuel.
But they have to be abstinence for 2 to 4 weeks, so they can't have
Ooh,
sex for
that's
2
a
to
big
4 weeks.
sacrifice.
That
to
is.
get.
Yeah, huge
Huge.
Wow.
And is that more
Who knows if
common
they're
than we?
following through?
Sorry?
Who knows if they're following through with a 2 to 4
Right.
weeks?
Yeah.
I know. Well,
Is it the same with the O? The O one?
Yeah, tell
let's
us
talk
about
about the
the
O shot.
O.
Yeah.
This is fascinating.
Okay.
So with the O shot, what we utilize usually is PRP. Are you guys familiar with PRP?
Yeah.
I have, yeah. It's like your own blood or something, right?
I don't know what it is.
Yeah.
No.
Yeah, so we use your own like platelet rich plasma
Mm-hmm.
that has like
Oh.
growth factors to like regenerate and
Mhm.
stimulate. So usually we get the blood from that person, we put it in a machine to spin,
Mhm.
and that's how we're able to extract the PRP. And then the reason why it's injected back into the vagina, because it stimulates your libido.
Is it in the I just want to clarify. I heard it was you got a shot in your clit. Is that not correct?
Ow.
Yes, your clit and
Okay.
both
And your vagina?
Oh.
labias and everything.
And
so
so you just are injected everywhere.
everywhere.
Oh,
Is
you
it-
told me
Why?
that.
Is it also just
It's stimulate-
topical like stuff that's put on there to numb it?
Yes,
Oh
topical
God.
lidocaine.
Okay.
And how big is that needle?
This needle is it's not the cannula, it's a
Okay.
sharp needle. So
It's a
you have
big
to
one
be
now.
mentally prepared. So
It's
I would say 1.5 inches.
oh Jesus.
Not that
That's
Oh,
way
bad.
bigger than a Botox needle.
oh.
Mhm.
But
Yeah.
I'm confused. Like, why would anyone want that? If I mean, does it happen? Like, you could be sitting in a meeting, and then all of a sudden you have a big O.
The big O is orgasm, people. Let's just call
Yeah,
it what it is.
I know, but I don't want to
Just
be in
for
a
the listeners.
meeting or like a church or something,
In a
visiting
Well,
church
you're
on
praying
Easter
to God
Sunday.
and having an orgasm.
Yeah, like, does it just happen anytime, or is it something like where
How
you're
does it
getting
work?
sexual? Yeah,
How
tell us
does it
how it
work?
works.
So it enhances like sensitivity down there, so it can help you get to the big O. It also helps with natural lubrication.
Mm.
Hmm.
And then it also helps with pelvic support, and then it helps mild urinary leakage too, if you
Oh,
guys weren't wondering. But
Yeah.
yeah, it helps with a lot of things.
wow.
It
Wow.
It's
doesn't
like a
directly
miracle
help with your
ingredient.
orgasm, but it's more of, it's more of a booster,
Oh,
orgasm,
okay.
orgasm
I
booster.
was told maybe I was misinformed, but I was told I have some friends of friends who go to Miami for this and they get in their clit and they have like spontaneous orgasms.
Why do they
It's
go
like
to
a
Miami?
Maybe it
it's
happens to
very
some
big.
people.
It's a
Maybe it
very big
does.
thing in Miami.
Oh,
Maybe it affected that person that way, or
Or you have nothing else to do and you just want to
yeah,
have spontaneous orgasms.
exactly,
Why not? And you can pay for
exactly.
it.
and you fly to Miami.
Mhm.
And then, yeah.
Let's talk about cost here. What are we talking about?
Yeah.
The P
For
shot
that.
and the O shot.
Yeah.
Yeah, it
How much
could
do I need to
range.
save?
Yeah, it could range for the OSHA. It could range between like 1K to 2,500,
Damn.
but you
Jesus
can't just
Christ.
get one treatment. It's with any aesthetic procedures. You need at least 2 to 3 to
Damn.
start seeing
Oof.
full results, and you have to maintain it. You can't just one and done and be
Yeah.
like, okay, this is it.
Oh.
You have to do it
You
like every 4 weeks.
Ow.
Yeah, it's more
Ow.
of a lifetime subscription
Oh
too.
my
Wait, you get a
gosh.
lifetime subscription if you do this?
No, you just have to
No,
do it.
you
Oh,
would
you
have
just
to do
have
it
to
all the
have
time.
There's no
oh.
official O club.
Okay,
like,
I thought maybe
fee,
that's what she
but
was
maybe there
implying,
should
that
be.
like if you
Yeah.
can join the O club. I don't know what would happen at the O club
I
then.
think women would join the O club.
The O club?
Yeah.
You'd show up for like, is it like the equivalent of a book club?
It's the needle thing. I can do a laser down there. I can do wax down there.
The laser
numerous
is,
needles would freak me out a little.
yeah,
Yeah.
that's like a no.
Yeah.
So, okay, so you see a lot of obviously vaginas and penises. So, have you ever had to tell a client, no, you got to go see a doctor instead for this? Like what if it was like, wart or something, and you're like, I can't laser that off, Have you ever had to
Yeah,
tell a
have you
client
actually-
like,
Yeah, for sure, all the time. It's really important to
all the
always-
time?
Wow.
Oh, jeez.
that's crazy.
Like genital ward, you're just like, oh shit.
Ew.
That's a
You're
big
like,
one.
that does not look like, like it's an STI or something, right?
just for their safety too, because
Yeah.
you don't want it to spread.
Right.
Yeah.
Inject into a certain area and then inject into other areas is gonna be spreading around. You don't want that to happen.
Wow.
Yeah, they have to have we definitely consult them before any procedures.
hmm
If it's contraindicated, for sure, I turn them away because, they're paying a lot of money, but then you get like a bad outcome, and it always falls on the provider, regardless of the situation.
What are you asking them? Have you had an STI lately? Are you
Yeah,
sleeping
just
around for a
do you have a
while?
history?
Or tested?
Yeah, any of those histories.
I don't remember you asking me this, Gabby.
Maybe there was nothing
You're
to,
special.
Nothing to report.
You're
Yeah.
special.
Not right.
Maybe she was like, okay, she
Just
looks normal
trust.
there.
I do look
She looks-
pretty mild.
You look mild
I
down
know.
there.
I know.
Eh.
It's not mild. Do you have any crazy stories where clients are either confessing to you about something that you weren't expecting, or anything that kind of crazy stories as you're
During
doing
the laser.
procedures,
Oh,
During
great
the-
question.
or
Mid-laser.
awkward moments with
Yes, we want to
know
know.
where your head's down
Yeah.
by their crotch?
Yeah, so for the pee filler, I
Oh,
did this one patient and he was telling me like his wife is really surprised like how big his penis has gotten in a month. And I'm like, oh
wow.
my gosh. He's like, yeah, she's so proud of me, blah blah blah. And I'm like, oh my gosh, this
She
is a
doesn't
crazy story.
she
You're
doesn't
sa-
know?
you're saving marriages here. Oh
Oh
my
my God.
goodness.
Wait, she doesn't know? Is that
No, she was just this is what he was telling us, but you know
What?
how guys exaggerate everything.
Yeah, yeah.
He's just like, "Yeah, my wife literally thinks like, my penis is
It's
growing."
growing? Oh my
What?
god.
Come
no
Who
on.
is this
way.
wife?
No way. She's
Come
totally,
on.
there's no way.
She's in denial.
Yeah.
Or
That
I
was
would
Yeah.
one
just
of the
say
most
it.
I don't know.
Although if you're benefiting from it, I would just feed into that
That's
and be
true.
like,
That's true. But
it's
Remember.
magical.
that's why he pays in cash.
Yeah.
That's awesome.
Oh my gosh, Gabby. Well, we have a million other questions for you, but we have to go,
So
unfortunately.
sad. I
know.
Thank
love
you.
talking to you.
Thank you
Yeah.
for coming on.
Thank you for having me. I really enjoyed this.
It's-
And I hope this was informational for everyone listening to this
Uh,
amazing podcast.
yes,
Yes,
we're
I
all
learned.
educated.
Yeah.
These two are very educated
I
now.
learned.
Thank you.
I knew a little more than them.
Yeah.
Um,
I learned from her actually.
Yes, I know.
So we ask every guest who's on the show to use the word of the episode in a sentence pertaining to their occupation. And let's be honest, you taught me this word, so I know you know how to use this word in a sentence.
Oh, the everything shower.
Mhm.
Yeah, it's a very, very ritual thing for men and women. That's something that I really value, and I feel like you have to like mentally prepare yourself before you do your everything shower.
Gabby, what advice would you give your younger self
About
So my
relationships.
or about
advice would
relationships?
be like not taking everything so serious in life. I feel like, after being in the medical field, like there's so many other bigger fish to fry and like
Mm.
Mm.
so many different like things. Sometimes I'm like so dramatic about an inconvenience and I'm like, wait, like, it's not a big
Yeah.
deal, girl. Like get up, like get your shit together. Like it's literally not that big of a deal.
hmm
I
And
love
like
that.
and
Sam.
like, you think like people care so much, but I'm in my head, I'm like always saying that when I was younger, and then now that I'm older, I'm like, literally nobody cares.
Nobody
Do
fucking
whatever
cares
you
I
about you.
want,
Yeah.
know.
say whatever you want. Literally nobody cares. And that's my favorite advice ever because it's allowed me to do whatever I want, but in a positive way.
Yeah.
Yeah.
Like being proud of who I am.
Nobody cares. And
Nobody cares.
get
They're
your
thinking
shit
about
together.
themselves.
cares.
Yeah.
Nobody.
I
That's
love
my
that.
favorite thing to say
Nobody
to
That's
fucking
people.
smart.
Literally
cares.
nobody
It's true.
cares.
Yeah. No one's
Actually,
looking at
nobody
you.
cares.
No.
Yeah.
They're worried about themselves.
Yeah.
Like,
I used to think
Obviously.
that was a negative thing, but now that I'm older, I'm like, oh my God, thank God nobody cares.
Nobody cares.
yeah.
Oh my
That's
gosh.
why we're sluts here.
Yes.
Nobody fucking cares. about
Nobody
us.
fucking cares.
Nobody fucking
Nobody
cares.
fucking
care.
cares.
We care.
We
Well,
care about each other.
Yeah.
Gabby,
That
thanks so
matters.
much for coming on the podcast. This was so cool. I learned a lot. I feel very educated now. Yes.
hmm
All right. And then sluts, thanks for listening. Follow and subscribe for more slutty moments. Sluts out.
Let's
Sluts out.